Hey amazing mommies, welcome and welcome back to the channel. I am here with another informative and educative video. In case you are coming by this channel for the first time, my name is Priscilla. I am a licensed and registered health practitioner. On this channel, I share informative and educative content around motherhood, parenting, maternal and child health, family health, mental health, and how it affects us as mothers. I also share my experience as a Nigerian mom of three living in Lagos, Nigeria. So if this sounds like what you love, consider hitting the subscribe button now. Turn on the notification bell as well so that whenever I upload a video, you'll be the very first person to get notified. Also do well to share this video to every mother and every potential mother in your contacts. Having said that, let's dive right into today's video. Today, I'll be sharing something of utmost concern, and that is colic in babies. It is of utmost concern because so many mothers do not really understand what colic is, and they get to panic and do a whole lot of things when they see their babies going through colic. I remember a particular scenario when we had a 3-month-old baby brought into the hospital with intestinal obstruction. According to the mother, what actually happened was that because of the constant crying and discomfort the baby was passing through, they went to a chemist or a pharmacy, I don't know, where they were giving this particular drug, and I don't know if they were given a wrong prescription or they themselves were the ones that mismanaged the drug. So as every point in time the baby cried, they administered the medication. At every point in time the baby cried, they administered the medication, not minding the interval or the dosage the baby should take and everything. So before you knew it, the baby tummy became very protruded and hard. Baby could not pass stool, could not gas. Baby was not eating anymore, had terrible fever, and a whole lot of things just went wrong. And before you know it, they landed themselves in the hospital, only for the doctor to diagnose intestinal obstruction. So this is what is happening out there. This is what a lot of mothers do not know, and they mismanage this condition and they land themselves in a very terrible, and the baby in a very terrible situation, which is very disheartening. Now, what is colic? Colic is a normal problem or condition in babies. It makes them cry a lot. They cry without any obvious cause. They become very uncomfortable, and they just cry without any obvious cause, without any obvious reason. They just cry and cry. Crying is a normal thing in babies. That is how they communicate their needs. But a colicky baby, you just watch this baby cry and scream, and you'll be wondering, what is wrong with my child? This baby did not fall down. The baby is not hungry because obviously they eat well. Everything is just okay with a colicky baby. There is no fever, there is no loss of appetite. When the colic is not there, they behave very, very okay, very, very okay. But as soon as the colic starts, they start shouting and screaming, and this particular condition or situation make mothers go haywire. Like, they begin to imagine and they are worried because they cannot sleep, they cannot do any chores, they cannot rest. You just keep rocking the baby, you breastfeed, you do this, you just look for a way to pacify the baby, and nothing is working. They are just inconsolable at this point when colic is happening or when they are going through colic. Now, colic in babies is normal. It's a very normal condition. It is harmless and it passes away with time. It runs its course. It starts from about 4 to 6 months, or 4 to 6 weeks after birth, and it continues till about 3 to 4 months. So within this phase, you see that the baby just cries without any obvious cause, without any obvious reason. Baby will just finish eating, and before you know it, the baby is crying and crying. So that baby is experiencing colic, and it is not something that you should kill yourself about. It is something that you should just give time, and it will just run its course and go just like that. Before you know it, discover that the baby does not cry that continuous cry anymore. Colicking in babies can be very frustrating to parents. It can be very, very frustrating. Researchers have linked colic in babies to postpartum depression and shaking baby syndrome. So managing colic can be very, very frustrating for parents. It adds to the stress and the fatigue of new parenthood. So you should always ask for help. If at this point you experience your baby having colic and you feel that you cannot just manage it alone, don't hesitate to reach out for help. It is very, very important so that you don't go into postpartum depression. Because of the frustration and the overwhelming stress while attending or trying to pacify a colicky baby. Most mothers have landed their babies into shaking baby syndrome. They do not know about this actually, it's unknown to them, but because of their overwhelming stress and they are just freaking out with the whole thing, they handle their babies in such a way that the baby will land into shaking baby syndrome. I am going to talk about shaking baby syndrome in a separate video because it is quite a broad topic. Now, what are the symptoms of colic? What will you see in your baby that will tell you that this child is experiencing colic so that you can panic less? First of all, when they cry, you see that they have clenched feet. Their feet, they raise their feet up above their stomach and they clench their feet like that. You know, when somebody is in pain and the person is crying, you know, they kind of clench their feet and they raise their legs high above their tummy. That is the pattern of cry that a colicky baby has, because actually at that phase they are passing through a lot of discomfort and pain within their abdomen. You know, they also pass gas most frequently. You see them gassing almost every time, and that is a good one because they actually that colic actually is a kind of a wind-like movement. You know, a kind of a wing-like movement, you know, going through the tummy, and it makes them to pass gas. And most times when they pass this gas to a reasonable extent, they tend to get calm a little bit. So that is how you know that your child is experiencing colic. The face, there's facial cremants, you know, or that painful look. That's what we call facial cremants. When you look at the child crying, you just know that this child is going through pain. You know, you look at the face, you look at the head, the legs that are raised high above their tummy. You see how they clench that feet. You just know that this child is in pain. You know, you look at their face is red because they are obviously crying and screaming. So when you see all this pattern of crying in your child, and you know that there is no fever, the child is eating well, just know that it is normal. This pain, most times, this colic comes at a particular time of the day, not all through the day. Most times it comes in the afternoon, most times it comes in the evening. But you discover that when the colic have not started, and maybe that child is sleeping or playing, the child behave very, very normal, very, very okay. But as soon as colic starts, the child will start crying and crying uncontrollably. I know the next questions on your mind now is what actually causes colic? Researchers do not know the actual cause of colic, but there are some other factors that they feel can play a very big role to colic. One of those factors are abdominal pain or discomfort from gas. You know, this same gas we made mention of. And most times they get this gas while crying or while breastfeeding, or even the bottle feeding. They can get air through these two means. So the air being accumulated in the stomach can lead to that discomfort and wind-like movement that we talked about that gives them that pain and discomfort and makes them cry a lot. So the second factor is reflux of stomach content, that is bringing up of the content of the stomach, what they have eaten. So that can also cause colic. That can also make them to be very, very uncomfortable. Then milk protein intolerance can be another factor. You know, there are some proteins in milk that they cannot tolerate. If your child is maybe bottle feeding, there are some contents in that particular milk, artificial milk you are giving, that the baby is not just okay with. It can also cause that discomfort. Another factor is underfeeding and or overfeeding. Another factor is allergy, food allergy from what you eat as the mom. I'm going to come to that in a jiffy. That is another factor. Then the last factor is that developed digestive system factors can contribute to colic in babies. Now, are there any complications of colic in babies? Well, yes, there are complications on the part of the mother this time, not on the part of the baby. Because, like I mentioned earlier, researchers have linked colic in babies to postpartum depression and shaking baby syndrome. So, the overwhelming stress and the frustration attached to taking care of a colicky baby as a new mom has led so many parents into postpartum depression, you know, and into handling their babies in such a way that they will now land their baby into having shaking baby syndrome. So if at any point you feel that you cannot just deal with the whole situation anymore, if your child is having colic and you feel you need help, do not hesitate to talk to your doctor. Do not hesitate to talk to your family. Do not hesitate to talk to your friend. Talk to somebody and let them know how you feel. Let somebody come to your aid and give you that assistance that you need, so that it will overwhelm you and you don't land yourself into postpartum depression. Now, is there any cure or treatment for colic in babies? Actually, there is no cure to colic, but there are some steps you can take to suit a colicky baby. One of those steps is considering the food you eat as a mom. Remember that whatever you eat as a mom that is breastfeeding is what your baby gets. So it's very important you put what you eat into check. You may have to eliminate some milk products in your meal. You may have to eliminate caffeine, chocolate, nuts, and other potentially irritating proteins in your food that might affect the baby. Another step you can take is to introduce another formula if you are formula feeding. Remember earlier we made mention of a milk protein intolerance. This is where it comes to play. If your baby is feeding on artificial milk, you might have to change that milk, because there are some protein content in in some milk that some baby are very sensitive to, so they don't just tolerate it. So you might have to change to another milk, so that if it is caused by that sensitivity in that milk, the baby will get better when you change to another milk. So another step you can take to suit a colicky baby is to give a warm bath, introduce a pacifier, try and make sure that baby burps at every feed, so that they can eliminate every trapped gas. Remember that it is this gas that we are trying to deal with. That is the assumed reason why they have that pain and discomfort in their tummy. So by the time they burp at every feed, it reduces at which the rate at which they accumulate that gas. So let them always burp. Now sink to them, talk to them, rock them, pat them on the back, rock them maybe in their stroller or even in your arms. Do some outdoor activity, let them move out of that particular that room that they are used to. Just take them outside, but make sure that you wear them cap to protect them very well. Take them outside, play soft music for them, sing to them, talk to them. If you can act, try to distract them from what they are going through. I know it is very, very demanding. It can be very, very tasking, but these are the things that you should do to suit your colicky baby. So I hope that by now you now understand better what colicky is. Another thing that you can do is to buy out of the counter drug. This is coming very last. This is just the very last thing on my list, because you can actually do without it and you can actually do with it, but make sure you do not abuse that drug. Make sure you get a better understanding and you get a prescription from a professional before you administer that out of the counter drug. So these are the things you can do to suit your colicky baby. I hope by now you understand better what colicky is, what to expect, and what you ought to do should you feel overwhelmed at any point. Thank you for watching. I will see you in my next video.